So, I'm going to be talking about the role of predictive analytics in a clinical setting. So, based on the article from this week, it talked about how predictive analytic technology is being used within the healthcare field to help doctors forecast certain events for certain patients. One big problem that was pinpointed with this technology being integrated within the healthcare field is the potential for misuse. Um, One point that was brought up that I thought was really important was making sure that the doctors and the patients are both fully aware of how the algorithm was developed. This can kind of help them wrap their mind about any sort of biases that might be implemented within the program. And if a certain sample of patients was taken, um, I just thought that this was really important because it helps the doctor evaluate if the diagnoses that's given from this predictive analytics technology is accurate and how they should kind of move forward from there.
With the increase in technology today, I believe that predictive analysis is an interesting concept. Predictive analysis can basically create a prediction based off of a known data and create the best guess possible. But with this, there might be some problems with it. In the article, The Role of Predictive Analytics in Clinical Care, it states an example of how a PA algorithm may compromise physicians when helping patients. If a model recommends against offering an intervention, but it was meant to be designed to improve health population or reduce costs, it may conflict with what the physicians wanted for the patient. In my opinion, technology has definitely advanced today, but I believe that we should still create the solutions we believe is right.
Predictive analysis is used to forecast future health behaviors or outcomes, which can help healthcare officials make decisions in real time. Predictive analysis has been extremely successful in detecting visual symptoms in diabetic retinopathy and can also help in deciding what course of care is best for patients. In class, we saw how predictive analysis was used to analyze the behavior and the emotions from a student's Twitter account and how that can help predict if a school shooting is happening. But I think there are quite a few challenges that need to be addressed when using predictive analytics. In class, we talked about how data privacy can be violated, especially if this data is accessible within a public domain. Even though people's behaviors exhibited through social media can help predict their health outcomes, I think it's detrimental if this information is easily accessible, especially if it's in the wrong hands. To address ethical matters, I think there needs to be some sort of informed consent when we utilize patient data in healthcare. Another problem that the article lists is that the data can be misused or tampered with. I think that physicians and healthcare administrators may need to understand if the data has been validated properly, how the model has been developed, and if the appropriate individuals have been sampled. I believe that this will go a long way in helping healthcare officials use appropriate data to assist their target populations or their patients.
Predictive analysis has many direct uses in the healthcare field. The ongoing opioid crisis, for example, can be bolstered through the use of predictive analysis. A partnership between UCLA and Google Trends showed the efficacy of predictive analysis on determining opioid-related admissions, a powerful tool in stopping administration of opioids for unnecessary reasons. The study showed a variety of opioid-related search topics in different cities, Minneapolis and San Francisco specifically, and its frequency compared to emergency department admissions for each city. It showed positive correlations in both cities, with an increase in Google searches correlating with increased hospital visits in Minneapolis, and a decrease correlating with decreased hospital visits in San Francisco.
This article about opioid epidemic portrays how online search behaviors are used to predict future heroin visits and manage opioid-related morbidity and mortality. Geolocation of search behaviors can detect a more precise area of increased opioid-related search terms. Therefore, public health officials can proactively help educate the targeted community about opioid overdose. Agencies like the Department of Health and Human Services have used new methods that use real-time, low-cost predictive analytics to aid as potential solutions in addressing the opioid crisis in the United States. Some present methods, like social media and internet data, are very useful to extract information about public opioid related intentions and behaviors. However, there are some limitations in the Google Trends opioid search study. The common sample bias assumes that everyone uses Google as their search engine. Search data only provides keywords for opioids without context instead of social media like Twitter, which includes the context of people's thoughts and behaviors. Brown sugar was the most frequently searched term, but the analysis did not filter searches related to the actual brown sugar used in baking.